The death toll in the fresh Ebola outbreak in the Democratic Republic of Congo has risen to 80 as health officials are monitoring hundreds of suspected cases in the country. In fact, DRC's health minister, Samuel Roger Kamba, has warned that the current strain of the virus has a very high lethality rate. Speaking to reporters in the capital, the health minister explained that the fatality rate for the particular strain is as high as 50%, having added that no vaccine or specific treatment yet has been identified for the strain.
I would like to remind you that this strain has a very high fatality rate, which can reach as high as 50%. So the sooner we can treat you, the sooner we can resolve the issue.
The chief of the World Health Organization has assured that the agency will deploy resources to contain the spread of the virus in the Democratic Republic of Congo and treat those affected. Also, the WHO has released $500,000 from its contingency fund to support the response process.
We have deployed medical supplies and protective equipment for infection prevention and control to Bunia, the Ituri provincial capital. Today, I have released $500,000 from WHO's contingency fund for emergencies to immediately support the response.
DRC residents remain fearful and feel somewhat helpless in wake of deadly outbreak in the eastern region of the country with no immediate solution in sight.
We are very afraid. Since the beginning of May, many people have died and it keeps happening. We are very afraid. What is happening is that if someone has a headache, a fever, or a stomach ache, they die after a while. Nearby, there was a young man under 30. He arrived in the village on Thursday, and today we heard that he has died.
The problem we've noticed is that over the past 3 weeks, people have been dying in very large numbers. There are days when, in a single day, we bury 3, 5, or even 6 people. It starts off just with a fever, stomach pain with diarrhea, and then death follows.
DRC health officials say that nearly 246 suspected cases have been recorded in the latest outbreak, which also marks the 17th reported outbreak since the virus was first detected in the country in 1976. However, the current strain was only identified in 2007. The latest Ebola outbreak has been reported in the DRC's northeastern Ituri province. This is a region which borders Uganda and South Sudan. Frequent cross-border movement linked to gold mining has raised concerns over wider transmission of the outbreak. Uganda has also confirmed a highly infectious Ebola virus outbreak. The country's health minister has said that the strain appears similar to the one that's been detected in the neighboring country. It has killed 1 person in Uganda so far.
I think that the solution to this would be for us to have tests that are cheap, affordable, point-of-care tests, which cost very little money, that anybody who comes in with a fever, we can test them. That is number one. The second thing would be to develop algorithms that can utilize the existing parameters we are testing normally on a patient. CBC, renal functional tests, you know what we call the routine tests, to tease out Ebola.
The Africa Centers for Disease Control and Prevention, that is the African Union's top public health agency, has said that it was holding urgent talks with the DRC, Uganda and South Sudan and global partners, and this to boost and reinforce cross-border surveillance, preparedness and response efforts in wake of the outbreak.